Welcome back to another episode with Fit Nurse Anna and Dad Bod. So today, guys, I have a special treat. I have an interview with Dr. Naomi Campbell that occurred last week. I recorded it. I'm gonna post it. Now, bear with me, the video is long, but please watch it to the end. She's gonna talk about creatine specifically, okay, and its use in supplemental health. So it's worth it. Every bit of information she gives out there is worth listening to. So I'm asking my audience, stay to the very end. Okay, you'll enjoy this one. Out. Alrighty, so we are recording. All right, guys. So this is Fit Nurse Anna here. I have an amazing interview with the amazing Dr. Naomi Albertson. As you know, this is pretty much my quest on supplementation. I want people to know more actual facts and truth about what's going on out there. There are so many different marketings and you can just walk into a GNC and there's like a plethora of vitamin shops and everything. And just, I want to know what's really out there to give people actual information of what they should be looking for and taking. And let's talk about you and what you know about creatine, Doc. So.
Awesome. Thanks, first of all, for having me on. I really
appreciate
the opportunity. I am in the same camp as you as a sports medicine physician. I think, getting the right information and the real information is really important. So that all being said, I am a sports medicine MD. I did my training for medical school at Tufts University in Boston. And then I did my internship down in Southern California, actually at Loma Linda. And then I transferred up to Stanford's program in San Jose and finished there and stayed there for my fellowship. And believe it or not, I've actually been practicing sports medicine for 20 years. And it's been a blast, actually. So, that being said, I think I've had a ton of experience with lots of different supplements along the way. I think notoriously physicians are not particularly good at understanding nutrition because we get almost no training in it. But that being said, I think, I have a couple of friends who joke with me all the time because I've probably audited more classes than I would ever have needed, to actually become an RD at this point. But that being said, I think, it's really my interest in nutrition has been entirely directed to, help my patients and help the athletes that I'm trying to take better care of.
That's awesome. So you got my attention because of the creatine. So what starting with that? So I guess just give us a brief view. What exactly is creatine? What does it do? Like, how does it help in your body? Just a summary of what it is as a compound, I guess.
Yeah. So creatine is nothing new, right? Creatine, a complex amino acid that is made up actually of 3 amino acids, which are glycine, arginine, and methionine. And they are, made naturally in your body between your liver and kidneys. So we do manufacture some all by ourselves. But that being said, we also, can get it from exogenous sources. So things like, meat and fish, like salmon in particular.
Okay, so back to the creatine. Okay.
Yeah, so I'm sorry. So, okay. So what creatine is, let me just start from the top here. So creatine is a complex amino acid. It actually is a short chain amino acid. And so it doesn't meet the criteria to be a protein, but it also works very differently. And so I'll get into that in a second. It's made up of 3 amino acids, and we manufacture it in our bodies naturally between our liver and our kidneys. As we age, our manufacturing kind of goes down, so we don't make as much. And so then we need to rely on outside sources to get creatine. And what creatine is it's this complex amino acid. When we eat it or when we manufacture it, it hangs out in our skeletal muscle, primarily as creatine phosphate or pyrophosphate, right? And it hangs onto this phosphate group. So what the heck is important about phosphate is that we need phosphates to create energy. So when you've got all this creatine just hanging on to these phosphate groups and it's sitting in your skeletal muscle, and you go do your, 80% max rep, then you are going to need some ATPs, right? Some energy molecules to make those muscles contract. And if you've got this little storage hanging out in your muscle of extra phosphate groups, well, how cool. Then you can make your muscles contract stronger, right? So if you do that consistently, so if you have all these creatines just saturating your skeletal muscle, hanging on to extra phosphates, and you do the exercise of, strength training, then what you will see over time is that the skeletal muscle hypertrophies, or it just gets bigger and stronger. And so that's what all the research has shown, is that creatine increases strength. Does that kind of make sense?
It does. Now, for my viewers are going to see this that aren't like medically trained, when you're saying it attaches to the phosphate, you're saying it helps kind of create these like adenosine triphosphate.
It frees up a phosphate group
to
an ADP, so an adenosine diphosphate, picks up another phosphate and it creates an ATP that then allows that muscle contraction, right?
Okay.
So it's a very complicated set of chemical reactions that are happening inside your skeletal muscle. But again, the research has shown that when you have saturated, storage levels essentially of creatine in your skeletal muscle, that you should see increases in strength when you do the exercise. What I think is very interesting about creatine also is that, historically, there have been a number of ways to increase your creatine. And athletes have been using this for 50 years, right? And athletes are, always interested in increasing strength, whether they're anaerobic athletes or aerobic athletes, so strength athletes or endurance athletes, primarily because they all, at some point in their exercise, require that fast twitch, right? That's that speed off the block. They want that quick kick up the hill, right? Or a sprint up the hill.
The sprint and the...
Exactly. And so, so athletes have always been interested in creatine. And historically, when the connection was actually made with food, athletes who were eating very high protein levels from sources like beef and salmon, those athletes were performing better. And so it finally kind of came down to the science, right, of looking at what is it about those food groups that was actually helping those athletes. And so, creatine, again, it's been around for 50 years. There's lots of, some people have some concerns about it, but we can talk about those and dispel some myths, hopefully, as well.
I'd like to do that because there's a lot of myths out there. And like you said, even though it's been around for a long time, I feel like I still meet somebody that's kind of has like the wrong idea, I guess.
Absolutely. And it's been, I think because it, came from the world of weightlifters and anabolic, athletes, going after, like the CrossFitters of the world, the strength trainers, the gym rats, right? A lot of those athletes are using lots of things. And so creatine kind of got lumped into all of those performance enhancing drugs, or PEDs, right? We call them. So it's interesting because I think thankfully we can pull creatine out of that. Again, creatine is natural. It is something that we make in our bodies. We get it some from food, but you can take it as a supplement as well. And not all supplements are created equal. And, we can talk about that too. But I think, creatine is readily available. It comes in lots of different forms, but I always kind of tell my patients and my, the people who are asking me, like, should I think about this? Should I, maybe add it to my nutrition regimen? I think, I tend to follow the research, and the type of creatine that's been most researched is creatine monohydrate.
Okay. I was going to ask you that. So what are the differences between, because there's several different forms of creatine for supplementation wise.
Yeah,
So
there are tons. There are tons of different forms of creatine. I think the latest out there is creatine HCl. Um, and that's getting a little bit of press. It's interesting. I think, when you think about just creatine as the base molecules essentially, or base amino acids with nothing stuck on them. So no HCl, no pyrophosphate, no orotate, no ethyl ester, I mean, there's a gazillion different ones,
many.
right? Yeah, there's so many. So if you just look at creatine monohydrate, which is the one that's been studied the most, it's very easy to use. And essentially, the current recommendations for anyone who's thinking about using creatine as a strength enhancer are to use low doses, so just between 3 and 5 grams a day, and
Okay.
taking that consistently. Now, there is a school of thought out there that, well, you could get to higher saturation rates faster by using higher loads or loading creatine. But there has not ever been shown any research or evidence that supports loading over just using low
Using
doses
it.
there slowly. Exactly.
Okay.
And when I say slowly, I mean slowly is really 2 weeks. So what loading does is it gets you there, 3 to 5 days to your saturation of creatine holding on to those extra phosphates in your skeletal muscle, right? So I don't think there's much benefit to any of the newer ones. Creatine HCl has been touted as not having any edema associated, and there is no edema. There can be a little bit of intracellular water retention from creatine monohydrate. So some people, when they do loading doses, will actually feel bloated or feel like gut upset a little bit. But again, with low doses, we don't see that. And so it's interesting. I always giggle that creatine HCl is touting that, they're better because,
You won't
that
have fluid
you won't
retention.
fluid retention. Exactly. And I think you don't anyway. So it's kind of funny, right? I think, and then I think too, the other thing is that like creatine HCl, they're saying that they are 8 to 10 times more concentrated. And I don't think that that's ever been shown. I don't think that there's any need to be more concentrated. Again, the research is overwhelmingly supportive of low dose use. And it's super safe. I mean, I think that's one of the things that gets brought up a lot with creatine. And certainly when I talk to, my younger athletes about use of creatine, it's, it always catches their parents' attention. Like they're like, whoa, wait a minute. What are we talking about
All of a
here? Like,
sudden they hear and it's like,
yeah. I mean, it's like, wait a minute, is this a performance enhancing drug? And I'm like, no, we're not going down that road. Absolutely not. But I always tell them, like, you can increase your creatine by just eating steak, right? So if you want to go that route, great. I mean, I'm a huge advocate of, eat what you can and take, your nutrition out of a bottle only if you have to, right?
which
So,
it
yeah,
makes sense. So
yeah. No, for sure. But it's hard. It's hard to eat. You'd have to, after the age of 35, you'd have to eat about a pound of beef a day, which none of my, older athletes are going to do. And the cardiologist would probably kill me. So that being said, I mean, again, like, low dose is certainly fine. It's safe. It's not been implicated in, anything really other than increasing your strength. Yeah.
speaking of that, so any more myths? So as far as there's people that I know that are very old school and they hear creatine, it's kind of like how you're
Yeah,
saying the parents hear it and they think steroids. All of a sudden,
absolutely.
like their mind goes to this is a
Yep.
performance enhancing, this isn't natural, and they kind of like
Yep.
that's it. That's all they know about it. So
I think the take home message, honestly, is that you still have to do the work. This is not testosterone. This is not growth hormone. This is not you putting something into your body that is going to make your cells behave in a way that they wouldn't normally. This is giving your body the fuel. It's just like, if you chose to, give yourself, calories, right, during your workout to perform. This is another way to support normal skeletal muscle function and to improve skeletal muscle function. But again, I mean, you can't, if you take creatine and sit on the couch, you're not going to see any changes.
You still got to do the work.
You still got to do the work. And I think the other thing, I think one of the other myths out there that kind of goes along with that, Anna, is that, if you take low dose creatine and you do the work and you see muscle changes and then you stop the creatine, I get asked all the time, am I going to lose all the muscle? Like you would with a performance enhancing drug, right? Like you would with the steroid, like you would with growth hormone, like you would with testosterone. And the short answer with creatine is no, it's not magic. If you don't put it in your muscle, it's not there. You will probably not be able to lift the same amount or get the quickness, right, from your sprint, but you won't lose the muscle. The muscle's yours. You worked for it. So, yeah.
Which makes sense because, like you're saying, if you can also get it from your food, if you change your diet, would it be like a similar effect, I guess, in a sense? Like,
absolutely. And if you look at diets of like NFL, linemen, right? Those guys are eating a lot of steak. Which is probably why they have cardiovascular disease early in life, right? They are really going after that very high protein and getting the benefits of the creatine and, iron and all the other good things that are in beef. But that being said, I mean, I think, many athletes try to eat it as food. The trick is, again, it's bioavailable in beef and it's also available in salmon. And, I could sit here and talk to you for half an hour about what's happening with fish in our oceans. But, salmon is a very big fish. And because it's so big, if you're buying high quality stuff, right, that's actually been swimming in the ocean and not being created in a farm, where it's being fed all sorts of, garbage, literally.
Like, not no pun intended. That's literally true.
I mean, right. So it's interesting. I think salmon, they are this big fish. And so unfortunately, if you're getting high quality stuff from the ocean, you're also probably getting quite a bit of mercury. And so then there's this whole other issue of, heavy metal toxicity and that sort of thing. So I tend to steer my patients and, friends and family to, with creatine, if you can afford to eat grass-fed beef, which thankfully does not seem to have a link with cardiovascular disease,
okay,
then that's a great source of creatine. But again, after age 35, you're going to be having to eat an awful lot of beef. And so, maybe supplementing with one of the creatine monohydrates that are out there from a reputable source, is certainly reasonable.
Okay. Makes it easier, especially on the cardiovascular, instead of your cholesterol going up and up and up because you're having to eat so much red meat.
Absolutely. Yep. Absolutely.
Okay. So I guess now on the subject, do you feel like this is actually something that could benefit general people, and not just the athletes, not just the athletes at the gym, you know what I mean, but just everyday somebody who may not want necessarily to gain muscle or strength or do a competition, but just want to have a better quality of life?
Yeah. So yes, the short answer is yes.
Okay.
The research on creatine there's a ton of research for athletes. Now, that being said, there's also some newer research in the last 10 years that focuses on 70-year-olds and older. And in that population, there have been a number of head-to-head trials that have shown that individuals who take low doses of creatine with protein in their diet And even if they don't do exercise, they slow down their rate of muscle loss that occurs naturally with aging, right? So I don't know about you, but I
That
mean, if
sounds
you're, that's pretty good, right? I
yeah.
mean, you even have to exercise and you're going to decrease your risk of getting really weak. That's huge. And it's huge not only for, for our patients and our, friends and family who are in, say, like a nursing home.
Mm-hmm.
Maybe your max rep is standing up from a chair, right? Maybe your max rep is walking to the bathroom, right? If you can do those things functionally, I mean, and as a nurse, you know that activities of
That
daily
is
living are what
a
allow you to stay
huge.
home
Yeah.
and not wind up in a nursing home, right? And so I think, none of us have a goal of living in a nursing home. That's just what happens when you don't have a good plan and things go bad, right? And I mean, I think it's great that they're there, but it's no one's plan for aging. And so if you could do something in your 30s, 40s, 50s to prevent muscle loss and the inability to do your activities of daily living, oh my gosh, what a no-brainer, right? So,
Uh, that's,
yeah.
that's
And then the other part of that research too on the 70-year-olds is that when you take those same 70-year-olds and you give them low dose, so 5 grams of creatine
mm-hmm.
and then a 60-gram protein diet, and you don't make them exercise, they still have a slower rate of muscle loss than their age matched controls. Now, if you take that same group and you give them an exercise program, the people who exercise will see significantly increased muscle strength as compared with the group that didn't exercise. So you're getting benefits like twofold, right? If you can't do the exercise, okay, well, you're still getting some benefit because it's slowing down your rate of loss. But if you could do some strength training exercises, I mean, even if that's, water bottles,
Walking. Oh yeah,
filling water,
water
walking,
aerobics. Like
standing and sitting from a chair. Like, I mean, these are the types of exercises that are being studied. And I mean, for that to show statistically significant changes in strength in a 12-week period of time, I mean, it's 3 months, right? That's like nothing.
that's amazing.
It is. It's amazing. And I think, like you're saying, I mean, this is just the general population, right? I tell people all the time, like, if you're already exercising, by all means, keep doing it. But that being said, if you're not, maybe just standing and sitting from a chair 10 times a day, right? Maybe stand up when you're talking on your phone. Maybe walk around your block if you can. So, I mean, I think introducing that level of activity to see those increased gains is, potentially huge.
Now, is there? I'm guessing that this is probably a dumb question, but like, there's no there's no other diseases to have to necessarily worry about vascular
Yes.
diseases or someone who has like an autoimmune disease or if
Yeah.
it's something that if we eat a piece of steak, we're gonna get creatine in one
Right.
way or another. So
Exactly. Yeah. So there, I mean, I think it's an interesting question, right? When creatine first hit the market 55 years ago, there were a number of athletes that became case studies. And they became case studies because they were using huge high levels of protein in their diet. And they were also using high levels of creatine. So they were loading. So they were doing like 20 grams plus, right?
wow.
Trying to load to these saturated states over about a week to 2 week period of time. And when those case studies, what happened with those, individuals was that they had kidney failure and they wound up with dialysis. And there was at least one young weightlifter who died. And I think that put a lot of focus on creatine, on, oh my gosh, this is horrible for kidneys. This is causing kidney damage. This is going to cause kidney failure. No one should take creatine. For a
I'm
long time,
guess
that
I'm
was the
guessing
message. Right.
was it probably due more to the high protein diet
You
though?
got it.
Okay.
Exactly. And you think about those athletes who are weightlifting, many of them are also dehydrating. So they're cutting weight, they're trying to sweat out water, right? So you
Mm-hmm.
bolus a high protein level and your kidneys at some point just can't handle it. So thankfully, there's been a number of studies done since then, I mean, over the last 55 years, to dispel that myth that creatine independently does not have any harmful effect to kidneys. So,
I
yeah.
love it. Um, do, do, do. I think you
Let me
answered them.
I throw in one more thing actually
No, go
about
ahead. Go ahead.
yeah about about creatine in our older population, our elderly
Mm-hmm.
population, because many of our our elderly populations never even heard of creatine. And it's really interesting because I think in the medical field, when I see patients who are thinking about surgery or who have had an injury and now they're going to be laid up with less activity and they're not going to be able to get going with their activity for probably several months, I tell all of them, you got to, do what you can do for your activity. So if you have a lower extremity injury, let's get going on curls and upper body
Right.
activity, biking and, using the upper arm bike and all that stuff. But I also talk to them a lot about nutrition and, how important it is that they continue taking protein as part of their diet, and that they do the math, as recommended by the International Society of Sports Nutrition to figure out how much protein they should take, and that they, really think hard about taking just a low dose of creatine because, again, with that research showing 70-year-olds and older slowing down their rate of muscle loss. I mean, that could be the difference between going home following surgery and going to rehab following surgery. And so I think, I tell them all, I'm like, there's no downside here. Let's get going, So I think in a medical, sort of scenario, creatine can be really helpful for helping your patients with rehab.
That's amazing. So it's something that it's not even not just a benefit to performance athletes, but to just somebody who is trying to recover from injury, trying to recover just their basic life back. You
Absolutely.
know.
Yep.
Wow.
Absolutely.
So I have to mention. So I know I told my audience that I'm not going to mention names or products, but you have made this worthwhile. Please tell us about your creatine real quick.
Yeah, sure.
So.
So, like I told you, I think at the beginning, I'm a sports medicine physician and I work in a large practice of orthopedic surgeons. And part of my job there had been beginning and treating some patients who have severe bone disease or osteopenia and osteoporosis who had complications, right, of either fracture healing or high rates of fractures. And I ran this clinic in our office for several years. I'm in the process, of course, got certified by the International Society of Clinical Densitometry and, would really do my best to kind of counsel patients about what changes they could make in order to improve their bone health. And in that process, because I had been doing so much research, reading through, just combing the papers, it sort of hit me as a sports doctor that here we are in the medical world pushing things like vitamin D, calcium, magnesium, but we don't help people so much with the exercise part of the equation. And part of that is because the research in medicine focusing on exercise as a treatment for poor bone quality or poor bone density has
Mhm.
never panned out to show that it increases bone density. And so, as a sports doctor, I was like, well, this is weird, right? I mean, people seem to have less falls when they're exercising, they have better muscle tone. We all know that balance is critical
Mhm.
following any kind of a lower, leg or lower extremity fracture or break. And so I just thought this is really interesting. Well, then come to find that there's quite a bit of research that shows that muscle mass or your lean body mass is actually what stimulates, in part, normal bone turnover. And so that kind of hit me over the head like, oh, well, that makes sense, right? Okay, obviously. I mean, of course, there has to be an association here. And so as I started putting together handouts for my patients, I thought, this is crazy. Like, I'm telling them to go to the store to buy high quality vitamin D3, which is better bioavailable, calcium citrate, magnesiums, and then I'm okay. And then we got a protein and we got to increase, let's throw in some creatine because the research supports that for your muscle. And then one day, one of my partners just kind of looked at me and he goes, would you just make it? And I said, that's a good idea. so, so I created a formulation of what is supported in the research to support your whole frame, right? So your bones and your muscles. And so all that's in it is those 4 ingredients. It's calcium, and it comes as calcium citrate, which is just easier to make bioavailable to your body. Vitamin D as D3, again, same issue. Magnesium, and it comes as oxide. And the reason I chose magnesium as oxide for the supplement is because oxide turns into oxygen in your bloodstream, and that's obviously usable by all of your cells. So that's why I chose that one. And then creatine, and it's creatine as monohydrate, 5 grams in our product, and it's called Dr. Nye's OC2. And it's a powder. You can put it into water, smoothie, or yogurt, or whatever. My personal favorite is ice cream. Um, just mix it up and slug it down. But I think it tastes like vanilla. Of course, it's all natural. I have had a couple of people ask me about why is there sugar in it, and there is a small number of kcals, 40 kcals per serving. And the reason that we put some cane syrup in there actually is because it actually improves the availability of the creatine. So
Really?
it
Okay.
increases your gut ability to absorb it. And so that's why it's in there. But that's it. It's, we have lots of different individuals who take it. Like you mentioned, Anna, I have a number of athletes who swear by it and have had great results. And then I also have, 70 and 80-year-olds who are taking it because they want to be able to stay home and not land in the nursing home, And so I think it's kind of a product that fits all those levels. We market it for anybody older than 35, only because that's, again, where the research is. There's very poor research done on younger individuals. There's nothing dangerous about any of the ingredients for anybody younger. It's just that I really felt strongly about staying in the world of, of research. Yeah.
I think that's pretty epic though, that because there is so much benefit to it. If somebody, I understand somebody said just wants to eat it from their food, then that's fine. But you know, just to be able to have somebody go from a hip fracture that probably couldn't walk to have a better recovery time and not end up bedridden, that that is amazing.
Yep,
So
absolutely. And I think everybody's muscle tone starts at a different place, right? And so, and muscle mass, I guess I should say. And so, if you're somebody who's very strong going into, say, a surgery, well, you're likely to do just fine following. So, I don't want your audience to feel like, oh, well, gosh, like, I don't, I've had surgery. I did fine following surgery. Of course you did because you have muscle mass. But we know from medical research that if I have, say, a frail 80-year-old woman who's just fallen and fractured her hip, the unfortunate likelihood, if she's frail, is that she is not going to do very well following that surgery. And part of it has to do with muscle and just your, the inability to return to, tasks that we take for granted of standing up and walking up and down a flight of stairs and being able to stand at your stove and cook your dinner, right?
I can tell you that I think there's a lot of people out there that take their basic stuff for granted like that. Like until they either lost it themselves or have seen somebody else, unfortunately, be able to do their activities of daily living, you really don't know how valuable it is until,
Absolutely.
yeah.
Yep. I always challenge my young patients, when they have an injury and they, but they're able to say it's like a knee sprain or something, and they're able to put their weight on their knee. I always tell them, well, it's your choice. You can use your crutches entirely and not put your foot down. Like, that's fine. That's a good way to, decrease the inflammation. Most of them come back like 3 or 4 weeks later and they're like, yeah, no, I put my foot down as soon as I could because it's so uncomfortable, right? It's for activity, daily living, like the fact that you can swing your feet out of bed and stand up. Wow, like what a nice function we have. Right. Anyway.
Well, so Dr. Naomi, any other like insight thoughts specifically on creatine? I'm gonna put links in the video below to your site as well, so my
Awesome.
audience can check it out.
Thank you.
No problem. And well,
I
any
have
closing statements?
I just have one other just piece of information for your
Mhm.
audience about just supplements in general. As an MD, and as many MDs, like I said at the beginning, I mean, we have so little training in nutrition, right? And so very few people come to their doctor for nutritional advice. Many people seek, advice from online or from, the GNC or from the
Yep.
Vitamin Shop or wherever. And I think, you have to know that you're asking for advice from somebody who may have equally or less knowledge than your physician, right? And
I would say less,
yeah,
probably.
with that being said, I think, one of the most, one of the things that I think is important to understand about supplements is the FDA oversight. And, as an MD, I felt very strongly about that for my supplement. And we actually manufacture with the manufacturer in the US who outsources their, how do I want to say this? They outsource to another company to check the purity and validity of every ingredient that they carry in house, right? And so I'm going to back up. I'm just going to clean this up. So, okay. So something that I think is really important for your audience to know
Mhm.
is about just how supplements are created and how the oversight of supplements happens in the United States. So supplements can be created wherever you want to create them. You can create supplements in your garage if you follow the FDA recommended practices for labeling and you don't make health claims that aren't true, right? So if you have a fancy labeler, you can truly package your own supplements in your garage. Now, that being said, thankfully, most companies don't do that. Most companies are actually using a manufacturer, but the FDA, the way that they keep track of supplements is through the manufacturer. And so every manufacturer has to submit 3 ingredients, their purity testing, and their sources, so where they're coming from in the world, every quarter to the FDA. Okay, so you can imagine how this goes, right? This is like the FAA. So they are self-regulating. These manufacturers are self-regulating. And so many manufacturers choose their same 3 ingredients they get from high quality, places, typically within the US,
Mhm.
and they submit reports on those 3 ingredients every quarter, right? Other companies use outside agencies to actually check the purity and stability of every ingredient and submit for them. And along that game, there's also this sort of random selection process that's a whole nother step up from these outside companies that increases the likelihood that what it says is in the bottle is in the bottle, right? So it's really kind of this interesting process that the manufacturers are allowed to self-regulate and submit on their own. And so I encourage absolutely everybody I talk to in my office to get smart about their supplements. If you get your supplements from GNC, GNC is going to slap a GNC label on there. You don't know where that supplement came from. You don't know where it was manufactured. You don't know which GNC manufacturing plant it came from, or if, like Costco, it came from lots of different places and then just got rebranded, right?
Yeah.
So, historically, places like Whole Foods have used very high quality manufacturers, but that's changed because Amazon bought them. And so it's really interesting because what you can do as a consumer is you can look at the label and you should be able to see who manufactured it. And you can, pull out your smartphone and look it up and see if that manufacturer is self-regulated or if they are using an outside company to regulate what's coming through their shop. So, I mean, it's kind of an interesting process. And
Very.
and I can tell you, like, as an MD, I mean, many MDs are against supplements because of this issue, because it's so poorly regulated. And there have been so many studies looking at, whether what's in the bottle is in the bottle and shown that what's said is in the bottle is not in the bottle. And so I think that's why so many MDs are just not interested in the world of supplements and will often tell people, oh, don't take it. It's just going out in your pee, or, oh, don't take it. It's not worth it. Or, they don't know, always. And again, I think as a consumer, it's really up to you to do your homework and look at the manufacturer and see if that's somebody that you trust. And make that decision for yourself, for sure.
I think just adding on to what you're saying there is that not to forget that the people selling the products might tell them something, but at the end of the day, they're salespeople.
Yep.
They're not medically trained. They're not dietitians. They're not MDs. They're not nurses. They're not, respiratory therapists. I don't know. Pick a, pick a career. But
right.
they're salespeople, and that's what they're there to do.
Yep.
So.
Absolutely.
So, cool. Well, Doc, thank you so much.
Oh my gosh, you're welcome.
This has been awesome. Alrighty, and I will see my audience a little bit later. Well, guys, this is Fit Nurse Anna again. So I want to recap some of the stuff that the video went over. First off, I want to thank Dr. Naomi. She was awesome. She gave me so much insight, some stuff that I knew about creatine, but there was a lot that I didn't. And thanks to her, I feel like I actually broadened my knowledge, and I hope that you guys feel the same way after watching this video. So thank you, Doc. You were awesome. Thank you for your time. So a couple of the myths that we went over in the video, if you guys were listening, creatine has nothing to do with anabolic steroids. Again, not saying there's anything like against if you're going that route. Always go to your doctor, don't break the law. But creatine itself has nothing to do with anabolic steroids, okay? It is a compound that's found naturally in your body. If you eat a piece of steak, you're pretty much gonna have creatine in it. So whether you're getting it through a powder or whether you're getting it through your diet, it really doesn't matter. Again, like she was saying though, when you're eating it and you're eating it through red meat, say for an example, red meat's full of fat, has a lot of cholesterol, so it can have some cardiovascular issues. So just kind of have that in mind when you're weighing out what it is that you want to do, okay? From what she was telling us, the rumor of it causing damage to your kidneys or causing issues like that has nothing to do with really the creatine. There's no real studies that show an actual independent correlation between creatine and kidney damage. A lot of the athletes that end up with kidney damage is because they are dehydrated. They're cutting weight. They either want to look a certain way or they want to meet a weight class. So they end up doing damage to their kidneys because of the dehydration or the high protein diet or both. Creatine on its own really has nothing to do with it. So remember that. On the other hand, though, there's been plenty of studies apparently that show that creatine has actually helped maintain muscle mass in the elderly. So again, since it's something that's found naturally in your body, you know, the older you get, and it's not just creatine, a lot of our body systems start to break down. So when you have somebody who's elderly and can go on a supplement that can actually help support their muscle tissue, that's a huge thing. All my people out there who are young, some of you probably have no idea what it's like, but when you lose the ability to just be able to walk or be able to stand or be able to even feed yourself, or, you know, not have the shakiness or not feel strong, when you lose your abilities, your activities of daily living, it's a huge thing. So creatine has been able to help people, just people in general, not even athletes, to be able to keep going with their lives, to be able to gain muscle strength where they had none before. Again, don't forget, it's not a miracle drug. You're not just gonna take a scoop of creatine and all of a sudden you're gonna turn into Arnold Schwarzenegger on his heyday back in the classic physique era. It doesn't work that way. But in combination with exercise, whether that be anaerobic or aerobic, it can help boost your strength level over time. From what Dr. Naomi was saying, you don't necessarily have to overload and try to get 20 grams in a day and try to overload within 5 days. She recommended anywhere from 3 to 5 grams a day, and that slow and steady maintenance to help you get to where you're at. Usually takes about 2 weeks is from what she was telling us. So remember, sometimes slow and steady wins the race. Don't overdo it. It'll help you improve and get better, okay? Again, I'm gonna put links in the description below to her site and her YouTube site. You guys have any questions about this video, please go ahead, put in the comments. I'd love to hear your opinions. Be nice, no nasty grams, okay? I want it to be an open conversation. Other than that, guys, this is Fit Nurse Anna. Make sure you like, subscribe, and hit the notification bell, and I'll see you guys later. Bye.